Francisco doesn't want tasers. San Francisco doesn't need tasers. The San Francisco Police Department has been given the chance to set a national precedent in how they respond to crisis situations through the implementation of the crisis intervention teams. Instead of prioritizing the trainings and the culture shift that's necessary to save lives of our most vulnerable populations, Cheif Suhr is instead promoting a new, shiny, lethal weapon called a taser to be used on people experiencing mental health crisis. Studies and lawsuits have shown that tasers are a deadly weapon that do nothing to lower fatalities or police shooting victims. You'll hear more testimony today that highlights lawsuits and respected studies done both here in Northern California as well as nationally that expose the harms of trigger-happy police officers who rely on excessive force instead of basic, culturally competent de-escalation tactics that could have saved lives. San Francisco needs to invest in real strategies for supporting our vulnerable communities and not lethal weapons.
CIT is still very much in process, which is why my opposition to tasers. I've had 3 trainees for CIT so far, and it still is a training. It's not yet a team. Working with Department of Emergency Management, 911 operators, extensive follow-up evaluation of CIT efforts, debriefing quarterly with leaders of SFP on crisis incidents. Those are things we need to really be working on first.
The crisis intervention team is nowhere near being completely implemented. None of the other parts of the program have been deployed. There's a 911 protocol that's meant to be deployed where the dispatch is flagged for a crisis intervention team. There's been no change in protocol for responding to crisis, putting CIT officers in charge of the scene, nor intensive evaluation of de-escalation techniques used in the field. Comments by Commander Ali saying that words don't work sometimes when in fact the whole point of CIT is to deal with people who are unable to respond to verbal commands or traditional command and control techniques shows a fundamental, perhaps even understanding about what crisis intervention team is meant to be.
How do tasers work? How does that electricity work in the body of someone with a heart arrhythmia that you can't tell by looking at someone?
I've been in the Tenderloin for 40 years. I've dealt with many people in crisis on the street, in our several facilities, and in our safe house for homeless, addicted, prostituted women who are trying to change their lives. One woman who suffered ritual abuse and pimping by her parents from an early age. We never know what will trigger her into sometimes aggressive behavior. She's about twice my size. I've had to interpose my tiny body between her and others more than once, but always we have been able to bring her down. Please do not allow tasers.
A police officer made a snap judgment on the medical condition of someone that they were about to tase. I look fairly hale and hearty, but I've had a triple bypass. Psych techs work in a job where they're constantly working with mentally ill people. They don't use them.
This is being brought up seemingly before the crisis team has even happened. I could maybe understand if they wanted to bring the tasers after a few years, but to do this right away is obviously counterproductive to a crisis team. It's obviously that there's issue of money at stake here in terms of, tasers and big industry.
Tasers are as lethal as any gun. And if you spend half the money that you have spent on debates, surveys, documentation, and little meetings like this, on back into the mental health facilities and the hospitals and the homeless shelters and get these people off the street, these officers wouldn't be having half their problems.
The police assassination of Idris Seli, Ving Cui, and Pralith Prolong were nothing other than assassination and should not be used in this context, especially Pralith Prolong, whose family explicitly requested the case not to be exploited for this. Commander Ali's assertion that a person under the influence of drugs or experiencing mental health episodes would have a greater pain tolerance. The documented science is inconclusive. What is conclusive is the severe threat to their vital health that is posed by tasing. In Portland, just a few weeks ago, a settlement was reached after a Department of Justice decision against the Portland police for the misuse of tasers, specifically against people with mental health issues. The plea bargain will cost $3.5 to $5.4 million annually, including CIT, including housing and treatment. Lawsuits will happen. In 2010, The United Nations Committee on Torture declared tasers, including the X-26, a legitimate torture weapon.
I was tasered in 2004. This is here my living proof of the long-term damage of tasers to my sciatic nerve and the conjunctive tissue between the femur and the cranial bone.
Please, dear supervisors, supporting and opposing against tasers, against any kind of weapons to killing people, more with mental illness, or homelessness, who is living without any protection, any support.
We talk about having another tool in our toolkit. A sledgehammer is a tool, but the heart is also a tool. For people in crisis, what they need is an appeal to the heart. The easy thing is to react and reach for a tool when you're actually ignoring the tool that you already had. Making eye contact, toning your voice, the power of a human touch.
I have condition of health. It's no good for tasers.
The CIT officers, crisis intervention trained officers, trained to use verbal de-escalation techniques to diffuse a stressful mental health crisis encounter. If you have the choice of talking somebody down versus clicking a button, talking is stressful, it takes time, it has an uncertain outcome. Yes, there's more risk with talking. There's a lot less risk to the officer with a taser pull. The very sight of that taser on that officer's belt is a threat. Tasers can also be used as a pain compliance device that helps to undermine the spirit and the design of CIT, which is a verbal approach to de-escalation.
Why doesn't 911 know what the heck I'm talking about when I ask for a CIT trained officer? Why wasn't a CIT officer deployed in the last crisis that resulted in a citizen fatality? Why doesn't the B cop on my street know anything about the program? De-escalation training was scaled back by the SFPD, and their stated reason was lack of funds. How do we suddenly have the money to train the force to use another weapon of violence?
It's obviously an effective tool, unpredictable. You don't know what effect they have on perfectly innocent people.
I have an autistic child. If he ever had an altercation with the police, he would not know what was going on. I'm sure he would be tased.
Developed the CIT team training nearly 10 years ago, and it has not been implemented. There is a separate city team that handles mental health calls. Why not take these millions of dollars that are being proposed for more weapons, which are lethal, and take the money and enhance our mental health capabilities?
The San Francisco Police Department has proposed that they insert probes into the muscles of people experiencing psychiatric crises and shoot them with 50,000 volts of electricity at 3 amps. It makes me feel physically sick. Crisis intervention team, which is currently unfunded and not fully implemented. It in fact had not been implemented 10 years ago when it was passed at that time. The Police Commission directed last year that a team response be developed to people experiencing psychiatric crisis. This has not happened. The 20 to 25% of the responding officers extensively trained. It's not happened. That 911 has protocol to contact the team and relay specific information to them. Not happened. That a supervisor that's trained in CIT be on the scene and that supervisor develop the tactical response before the police response. Not happened. The officer's incidents data is kept and analyzed. Not happened. That if force is used, a community review occurs. Not happened. None of this would cost money. Tasers would cost money if we talk about the training of the defibs, the training on using the cartridges on the tasers. All of this would cost significant resources. De-escalation works. It works every day in San Francisco. Psychiatric emergency services, social service agencies, drop-in centers. We looked at all the studies that had been done on tasers the last time that this came around. What we found over and over again is that the tasers increase fatalities. The independent studies, not funded by the people profiting off these weapons, they found things like the 2009 UCSF study that fatal shootings by police more than double in the first year after the police departments adopt tasers. In following years, the numbers of shootings decrease, but still stays above what it had been before tasers. When tasers are introduced, they're kind of a new toy, they get used a lot, but even when that initial excitement levels out,
it's still not decreasing fatalities.